What advice would you give to someone navigating a frustrating healthcare system? We all know about that. If they're unsure about where to turn for chronic pain or mobility issues.
The one thing that I'm not sure that everybody understands is there are actually very few medical emergencies in this world. And most things have the ability to kind of play the wait and see or do the conservative treatment option. And I go back to my wife. We have kids at home, and when something goes wrong, she says, "Well, what are we going to do?" And I said, "We'll wait and watch and see what happens." And she doesn't always like that because obviously she wants them better as quickly as possible. And I understand that. That's the mama in her. However, my training and understanding, been through this from a clinical standpoint, is that most things we don't have to react to immediately. If someone has a fever, you don't have to bring that fever down immediately unless it's in a really serious range where it could be detrimental to the body. But that's at the 103, 104 level. That's not at 100. And for some reason, our society got in the habit of starting to immediately alter the body system whenever something changes. And you just don't have to do that. You want to give the body the opportunity to fight itself so that it can ultimately be stronger. And it's the same thing with a muscle, is that the more you use it, the stronger it gets. And so the immune system's the same way. But if you constantly give external assistance, then the body relies on that external assistance versus becoming strong itself. So I'm kind of going down a path here, but I'm trying to reiterate the point of why patients should ultimately choose the conservative option first. And it's because most things don't need aggressive intervention. If you ignore things long enough and you mask things long enough, then they do need aggressive intervention. And so my advice to people is to, specifically for pain, if you have pain more than 72 hours, you need to have somebody go look at that. And when I say somebody, I'm going to encourage you to see the chiropractor. If it's pain in the knee, if it's pain in the back, if it's pain in the neck, have it evaluated after 72 hours. And ultimately, they can get to the cause of it. They can restore function and then prevent this thing from deteriorating rapidly and becoming something that we need to aggressively treat.